All right, so welcome back to another episode of MedTech Trends. This is your host, Dorian. So today we have with us a very special guest. Dr. Elaine Chin is the founder of the Executive Health Center and the Bespoke Wellness Club at the Spa at Four Seasons, Toronto. They're both premier personalized medicines practices in Canada. They specialize in integrated healthcare with longevity and anti-aging offerings. Dr. Chin and her health professional collaborators at EHC, they offer all of their programs virtually through their offering Health in a Box, and that's a service with an aesthetic division called Skin Genes RX. I hope I got that correct, but we'll dive into those a little bit more later on as well. She's also an advisor to Good Housekeeping Magazine's Institute, which is based in New York and appears regularly on City Line's Wellness Wednesdays. The program is called East Meets West. She's served as the Chief Wellness Officer to TELUS Communications. And she received her medical degree from the University of Toronto in Canada, as well as her MBA from the same school's MBA program at the Raman School of Management. She's also the author of Global Mail's top 10 bestseller list book. The book is called Lifelines, Unlocking the Secret of Your Telomeres for a Longer, Healthier Life. So welcome, Dr. Chin. Glad to have you here.
Well, thank you, Dorian. Happy to support an expat.
Sounds good. All right, so we have a lot to talk about today. I'm really fascinated by this field of personalized medicine, personalized wellness, and what it can offer people, not just going through the healthcare system, but I think a little more broadly from a more holistic perspective on how to manage and approach taking care of yourself and your health. So I thought maybe we could start off with, because I know it's a relatively new space, relatively new speaking, and there are a lot of terms, and I think a lot of people kind of don't fully understand sort of the terminology around this. They might be used to hearing about, how hospitals work, clinics, and so on, but they don't know as much about things like precision medicine or precision diagnostics. So I thought maybe we could start off with just a couple definitions and just let me know what your perspective on what these things might mean to individual patients from their side. If we're talking about like personalized medicine, what does that usually mean?
Well, when you look at the industry many years ago, it started in the world of anti-aging medicine. And then that word got taken over by the Botox world, and anti-aging was associated with a lot of cosmetic brands. Then physicians who practice what I do practice determined that it would be called personalized medicine. And as hospitals started to brand themselves as offering personalized medicine in cancer care, we then morphed into another word called precision medicine. So it has some similarities, but it has some differentiators. Obviously now, let's take the word personalized medicine to start, because you asked. It fundamentally means that it's N equals 1. So what you're trying to do is identify what makes you tick as a patient and make sure that everything that we offer to you in terms of recommendations for treatment or recommendations for lifestyle changes are all very personalized to you based on testing. And that's why the word precision medicine came into being, because now we're kind of inferring that in order to be precise, you're inferring that you have to do something to get precise. So there must be some measurement going on. So I think that would be how I would summarize these synonyms, I would say.
Yeah, and I think we'll touch on this a little bit later, but the current sort of approach to looking at treatment decisions and diagnoses, it is based on like populations of people. So you would have a study at some point that kind of looked at a whole group of people, and then among those people, someone kind of examined this and found out that, okay, people tended to have, this diagnosis if they had these symptoms, but it's based on a population statistics kind of approach. Whereas personalized medicine, precision medicine, like you said, it's an N of 1, and it's really sort of looking at segments of the entire population. So now you can get a lot more specific with respect to what specific signs and symptoms correlate with individual people. It's not a holistic kind of view of all the general population. It's now looking at very, very small segments of people. I'm tying into my stats background here and trying to explain this.
Mm-hmm. N of one, or we say one size fits one. So you're correct. So one of the analogies I constantly use is that in winter months, everybody in the Northern Hemisphere is told to boost their vitamin D, and the usual conversation is take 1,000 to 2,000 international units. And what we've also discovered is there's certain people that have a defective ability to make vitamin D from their skin, and those people need way more than 1,000 or 2,000 units over the winter months to stay, quote unquote, in normal range. And this is a very important nutrient, given that we are now seeing by correlation that those in the intensive care unit due to COVID-19 seem to do far better if their vitamin D levels are high. 80% of those who did not do well showed that they in fact had low vitamin D levels. Mm-hmm. So we don't want to be just supplementing vitamin D generally. We want to be doing it specifically, A, to do the genetics, and B, to do with the actual vitamin D levels in your blood. So we know exactly how much to give you and measure again in a couple of months to see if you got where you needed to be.
So precision diagnostics are really the tools that are coming out. They have been coming up over the last few decades or so, and they're getting increasingly more precise. And those are the tools that are really allowing us to really personalize medicine to an extent that's never been possible before. And this is really where the fascinating sort of work and the innovation coming into medicine is really kind of heading. Now, the other piece that's really important here, I think, is just talking about what holistic healthcare is. And there's, I think, a bit of a distinction between that and wellness, and what we typically think of as wellness. So not just, getting a prescription, but also considering all aspects of health.
So there's another three words that I would say: holistic, integrative, and I think wellness can sit on its outside on its own. When we talk about wellness is how to stay healthy, both physically and mentally. I think when you generally want to say, how well are you? That's really what we're asking you. And when we took a look at integrative and holistic, what you're trying to say is, in theory, and especially when you're saying holistic, is body, mind, spirit. So that's holistic. And then integrative models are generally saying very fundamentally, it's East meets West. You have some Western practitioners along with some Eastern practitioners, and I think that's a good way of summarizing what I would call integrated healthcare versus holistic healthcare versus wellness.
With the healthcare background and the science background, even for me, it's sometimes difficult to kind of wrap my head around what these different philosophies or approaches to medicine kind of mean, and how to incorporate them on a day-to-day basis to individual people. How do you educate people that come from very different backgrounds or have never really heard about these things? And as I understand, you're still seeing patients, you're still treating patients in your practices.
Well, let's see. I think most of my clients come to me because they will start by saying, I want to learn more about myself than what my traditional family doctor provides to me. I know there's much more science out there, and I would like to understand what's available, learn more about myself so I can be my better self. So I think that's where you kind of go at it. I mean, when I first started with the whole world around genetics, a full genome would cost $250,000 to purchase. And now I would guess right now 23andMe is running it all, like the whole thing, because they're selling your genome. And it costs them $50 US, maybe it's even less now. So here we are, have the capability of understanding every single piece of your chromosomal information. What we know about it is less than 10% of what it really does and how it works together. So we've got a lot of learning to do still.
It seems to me that was kind of phase one, right? Of just being able to cheaply sequence genomes. Then going beyond that in terms of trying to explain to the patient what that ultimately means to them and their health. I think we have a pretty good idea of some very specific genes and a handful of more kind of complicated diseases that are impacted by a lot of different genes. but
Mm-hmm.
science is still very young, and it's still very difficult
Absolutely.
to piece all that information together to educate. What does it ultimately mean if I get my genome sequenced? What would that mean for my health?
Mm-hmm.
Um,
Right.
how do patients actually end up responding to this information? So you tell them tons of information out there, tons of different diagnostic tests you can do, and how do you get them to really? I imagine it's not everybody that wants to know this kind of information. So how do you get them to buy into this concept of we can take better care of your health?
Well, the good news is that all my clients who come to me are seeking me as opposed to I'm making them come to me because they have a bum knee or something and they need it fixed. And this, I say, you have to do this in order to get your knee fixed. They come to me because they want to be healthier. So that's a whole different philosophy. And so they're ready to listen. Do they listen to everything I tell them to do? No. They pick and choose what they like to do. And then they get a certain type of result and they're not happy. And I was like, well, I told you how to do this. You just don't want to do it yet. So here's the second step. So it's work in progress all the time, it's iteration.
You know, if you were to kind of dole this out to the entire population of people out there, so not necessarily just people that get sick and have to go to a hospital or a clinic, but the general population, and with the goal of let's try to prevent disease, and so you don't really end up having to go to the hospital except for rare circumstances or extreme cases. So from a general population perspective, would that require like a very different approach to healthcare altogether? Or do you really have to take it one step at a time, one patient at a time, and sort of rely on them to kind of, work their way from the bottom up into the system to create this change?
Great question. I've always wondered if I ever got into office and became the Minister of Health or Secretary of Health, what would I do? Do you solve one issue at a time? And we've done a good job with one thing, which is smoking, right? It's a public health program, and we've done a great job. What we've done a difficultly horrible job, and it's a difficult task, is to help reduce obesity, right? Starting with childhood. And before COVID, it was tsunami, and I thought to myself, with all things excluded in terms of the political overlay, over 50% of Americans are overweight or obese, right? So you start there and have underlying conditions. With obesity, you have prediabetes, hypertension, heart disease. You need to attack it in 3 ways. You need to attack it with exercise, eating properly, and sleeping properly. And that is a lifestyle commitment, is an educational piece, and it's an ability piece. We could arguably say that there is food insecurity throughout the system, wherever you are in the world, and those who do not fare as well in health have difficulty with eating well, sleeping enough because they may have 2 jobs, and the exercise variable to some extent requires time commitment and perhaps even investment in equipment. So it's a difficult task, and so the society has to change. Not just government, but employers have to weigh in, and we have to teach people how to eat better on a budget. It can be done, but we just haven't taught society, so it's problematic, right? So it's not an easy problem to solve, so I guess I'm saying to you that you can't just paint it with a brush. Certainly, there are incentives to try to get certain doctors to educate, but the people who need it the most in terms of the type of service that I provide are the ones who can least afford it in terms of time and cost. And that is where the problem and the variability comes. And it's just shown itself so loudly during COVID.